Hello everybody, this is a re-recording of the Texas Coastal Bend COVID-19 pandemic report given on April 10th, 2020 by the Corpus Christi and Texas A&M Corpus Christi Joint COVID-19 Modeling Task Force. My name is Dr. Chris Bird. I'm an Associate Professor of Molecular Ecology and Evolution, as well as the Director of the Genomics Core Laboratory at Texas A&M Corpus Christi. Before we get started, I want to acknowledge the Joint Task Force creation by Judge Canales, city leadership including Manager Zanoni, TAMU-CC President Miller, and Vice President Motti. There's really too many people to acknowledge right now in this one slide, but many organizations and people contributed to this work from across the Coastal Bend. I want to particularly recognize Philippe Tissot, Lucy Wong, Jason Selwyn, Brian Gillis, Scott King, Evan Krell, and Mahmoud Elfrey, who all were critical in leading the task force and creating the models and visualizations that you're going to see presented here. The region covered by the report is the Texas Coastal Bend, which includes all 12 counties and approximately 600,000 people that live here. So far, there's approximately 89 laboratory confirmed COVID-19 cases in the Coastal Bend. You can see that there's no indication of a plateau yet, with an approximately linear increase in cases total from March 23rd through to the present. You can see here that the cases are centered in Nueces County, but also are occurring in other counties across the Coastal Bend area. We had two objectives on the task force. The first objective was to address public concerns and questions about COVID-19 and social distancing, and our second objective was to enable evidence-based decision-making by our city, county, and state leaders. The pressing questions we addressed are: 1. What would have happened if we had never enacted social distancing orders? 2. What would happen if we ended social distancing orders right now, today? 3. Is social distancing working in the Coastal Bend? And 4. What could happen if we ignore social distancing to celebrate a holiday weekend, such as occurring this weekend with Easter, Passover, and Ramadan? To accomplish this, the first thing we needed to do was to estimate the transmission ratio of COVID-19 in Texas. The transmission ratio is simply the average number of people that each carrier infects, or the number of people that you would infect if you were to contract COVID-19 on average. What you can see is that this is representative of a transmission ratio of 4, where there are 4 people that are infected for every 1 person that gets COVID-19, and it takes just 2 steps for this to increase to a large amount of people. For Texas, we estimated this value to be approximately 2 to 4 individuals that are infected for each person that contracts COVID-19. This is a really large number, and it's something that should get our attention. The number is so big that it's akin to a fire, and if we let it burn out of control, it'll be very difficult to stop it. We need to stop this pandemic by extinguishing it before it gets out of control. COVID-19 is going to spread if the transmission ratio is 1 or above. As you can see, that means that if we do nothing to try to combat COVID-19, then it's going to spread throughout our community and throughout the state, as it has spread already across the world. The goal of social distancing is to reduce the transmission ratio below 1. If we can do that, we can contain the fire and we can extinguish it. Now again, what this means is that we reduce this number to, on average, fewer than 1 person are infected for every person that contracts COVID-19. If we can do that, we can stop COVID-19 here in the Coastal Bend, in all of Texas, and around the world. I think now is a good time to explain how we estimated these values and where they came from. First, we estimated the base transmission ratio of 2 to 4 from the fatality data due to COVID-19 in Texas as a whole. And 2, our impact of social distancing was estimated based upon a study from 11 countries conducted by Imperial College and reported in their Report 13. So what we're assuming is that we Texans and people of the coastal bend can social distance at least as well as the average country that was studied by Imperial College. Overall, the range in our estimate of the transmission ratio after accounting for social distancing can range anywhere from 0.2 to 2. And that means that if we're very poor at social distancing, then COVID-19 is going to spread and spread out of control, or we're going to put it out if we're really good at social distancing and everybody obeys the guidelines that are in place right now. So before I go any further, I want to explain what we mean by the term social distancing, because social distancing explicitly means you spacing out and trying to reduce the number of contacts that you have with people. But there's many facets to this, and the stay-at-home order is designed to also decrease the number of contacts between people, the stopping of public gatherings, the encouraging of everybody to wear breathing masks, and self-isolation when you realize that you're symptomatic with something that resembles COVID-19. All of these things can help decrease the transmission ratio of COVID-19, and we're categorizing them under social distancing. Additionally, good hygiene, washing your hands, and sanitizing frequently will help to reduce the transmission ratio. And lastly, laboratory testing for infection can help to reduce the transmission ratio, and we're including that as part of social distancing. We modeled 3 social distancing scenarios. 1, no social distancing. And what this means is that we're assuming a scenario where there was never any social distancing, no stay-at-home orders, no school closures, no encouraging to stay 6 feet apart from your neighbors and friends, and no shutting down of public events or restrictions on the number of people that can gather in one place. Our second scenario was end social distancing right now, today. What would happen if, given everything that's happened up to this point, we repeal all social distancing today and see what happens? And 3, this scenario is keep social distancing in place. We will keep social distancing in place in this scenario throughout the duration of any graph that you see, and we will maintain the present mandate. We won't increase it, we won't decrease it, we'll keep it at the present level. The approach that we took was planned for the worst, so we told you that the transmission ratio in Texas was somewhere between 2 and 4. We're going to use a transmission ratio of 4 prior to applying our social distancing measures, because if we plan for the worst, then we can't be caught off guard. We employed 4 models. The reason why we employed 4 models is because there's inherent uncertainty that go into the parameters and the way the models are built. This is not unlike a spaghetti model, which I think we're all familiar with here in the coastal bend from Hurricane Harvey and several of the other hurricanes and tropical storms that have come through the Gulf of Mexico in recent years. What we're going to do is, rather than showing you all of the predictions, we're going to show you the colored in region amongst all of the predictions to make it look like a one thick band. The data that we're using is from local, state, national, and international sources. If we can use local data, we do. But if we can't, we get the data from the most relevant source that's the closest to our coastal bend area. The 4 models that we look at are the Imperial College model from Report 13, the COVID-19 scenarios model from the University of Basel, the IHME model from the University of Washington, and the CHIME model from the University of Pennsylvania. And without further ado, here is the curve if we had never implemented social distancing here in the coastal bend area. To calibrate you, what this shows is the result across 3 of the models that we could apply this scenario to. And up here at the top, at the worst case scenario within our models of the worst case scenario of a transmission rate of 4, we have 300,000 people in the coastal bend being infected with COVID-19 at the peak somewhere in the next week from right now. Now I want everybody to realize that this is what would have happened if there had never been any social distancing implemented. Unfortunately, we have had social distancing implemented, and this is not the projection for right now. The best case projection from this worst case scenario of a transmission ratio of 4 is approximately 96,000 people having COVID-19 at the peak near the end of April. Okay, the next scenario shows that the curve could still be severe if we were to end social distancing today, with between 92 and 200,000 Coastal Bend residents contracting COVID-19 at the peak, which would be right now is predicted to occur somewhere in mid-May, were we to end social distancing on April 10th, 2020. You can notice there's a substantial peak, and in both the best and worst case scenarios here, if we were to end social distancing today, neither of these scenarios are desirable with this range. So if we were to end social distancing today, we would have COVID-19 run rampant through our community. The third scenario that we modeled was what would happen if we kept social distancing in place. And what you can see is that there is possibly no peak occurring within the summer months, at least out to mid-July, with a worst case of 87,000 residents contracting COVID-19 by, say, about the first week of June or the last week of May. Now, I want you to recognize that this is the flattest curve that we have, and this is generated from the worst case scenario, where the base transmission ratio is 4, but when we implement social distancing, we reduce it to 2, and it's still going to spread. So overall, with no social distancing, we have the worst projected peak with 100 to 300,000 residents contracting COVID-ID at the peak, somewhere between the second week of April and the last week of April. And this is had we done no social distancing at all. Now, luckily, we have done social distancing, so the blue shows you what would have happened or what would happen if we end social distancing today, and it shows that we're still going to experience a large peak with a large number of people getting infected if we were to end social distancing today. And the best scenario that we have here is to keep social distancing in place. It has the flattest curve, and there are scenarios or models within this scenario where we are maintaining a very low number of people infected in the Coastal Bend area. Social distancing is preventing a disaster at our hospitals. We're not going to go through the curves one by one from here forward. I'm just going to present them to you. They represent the same basic thing, except now we're changing what's on the axis over here. This is the projected number of people at the hospital, or at least the number of people that need hospital care. Right here, this gray line is our capacity in the Coastal Bend area. Excuse me. And what you can see is that in the no social distancing and end social distancing today scenarios, we far exceed the capacity of our hospitals in the area. And even with the keep social distancing in place, we're able to stay below capacity of the hospitals out until, say, July. Somewhere in July, the models show us potentially surpassing the hospital capacity if we're not able to decrease the transmission ratio by conforming to the social distancing orders that are in place today. So here we have a tsunami of severe cases. We have a many-fold over cap, even if we end social distancing today, and we stay within capacity out to July in the keep social distancing in place worst case scenario. Now, given this, I think it's important to say right now that the farther we go out in time, the less certain the model predictions are. So when we get out to here, we're not very certain in this prediction outcome. But when we're here in this area, between 2 and 4 weeks into the future, we can be much more certain. And what you can see here is that we're maintaining a low hospital load by keeping social distancing in place, and that we would incur a much higher hospital load if we were to allow social distancing to end. We also modeled a scenario to look at how many fatalities could be averted in the coastal bend by social distancing. So here we have our no social distancing, and what you see here is that we have a steady increase in the cumulative number of fatalities due to COVID-19 that would have happened had we had not social distanced, peaking at around 5,500. If we were to end social distancing today, all that we see is a pushing of this rise in the fatalities due to COVID-19 into the future, and still achieving that maximum number of approximately 5,500. So look at this a different way. If we looked out to mid-June, projecting that at least 4,000 fatalities would be averted by keeping present social distancing orders in place. And so this is a very strong argument for social distancing. And I hope we'll show you what social distancing is accomplishing in our community in the coastal bend. The last scenario that we tested was to see what would happen if nobody in the coastal bend area obeyed the present social distancing orders over the Easter holiday. Now, I know that this is a scenario that's unlikely, and that at least some portion of our community, hopefully a very large portion of our community, will take this seriously and obey the social distancing guidelines that have been put in place and the stay-at-home orders. But if everybody decided to disobey this order from Friday to Sunday, we project that by mid-June there'd be approximately 5 to 20 additional fatalities. So by social distancing during the holiday weekend, we can avert up to 5 to 20 fatalities by mid-June. And I think it's important that I clarify that under this scenario, we'd have social distancing up through Thursday, April 9th, with all social distancing stopping on April 10th, 11th, and 12th, and then on April 13th, social distancing going back into place is explicitly what we modeled. And there is a cost in human lives that's associated with that. Something else to consider while we haven't provided a visualization is that many more people need hospitalizations than perish due to COVID-19. And so the increased load on the hospital would be a lot higher than just 5 to 20 individuals. So just from that 3-day holiday, there could be a big impact on our coastal bend area if we don't obey the social distancing guidelines. So in summary, state COVID-19 transmission rates are estimated, and they're important for our models. We predicted an transmission ratio of COVID-19 in Texas without social distancing between 2 and 4. This is a robust estimate made using a Bayesian statistical model that is parameterized using the fatality data from the state of Texas. And this is the 95% confidence range of our estimate. We're 95% confidence that the true transmission ratio of COVID-19 without social distancing is between 2 and 4. Social distancing is estimated to decrease the transmission ratio to 0.2 to 1 with a mean of 1.0. Now, what this means is that we might still have COVID-19 spreading in Texas, or we might actually be extinguishing it. And I think we can all recognize that different parts of Texas might have different transmission ratios. And in some places it's going to be higher, maybe in more densely populated areas, and in some places it's going to be lower. Nonetheless, what's important is that on average across the state, this number right now is exactly 1, which means that we might be increasing or we might be on the decrease, and we're not quite sure yet. And one more time, this transmission ratio is the average number of people that get infected by somebody else that has COVID-19. Only when all people are infected and no longer infectious would this value go to 0. 2, social distancing is likely to be decreasing the impact of COVID-19. Remember, we took a conservative plan for the worst approach, and even given that, social distancing was very effective in reducing the projected number of cases, hospitalizations, and deaths due to COVID-19 infection. We're avoiding hospital and ICU overflow, which I can't emphasize how important it is that we can't overflow our hospitals. When that happens, then people that need treatment for things besides COVID-19 are going to have difficulty getting treatments, and that's going to increase the fatality rate indirectly from COVID-19 also. Continuing to obey social distancing guidelines over this holiday weekend is estimated to avoid up to 5 to 20 COVID-19 fatalities by mid-June, and we're avoiding even more hospitalizations and ICU cases than fatalities. It's too soon to stop social distancing right now. If the estimated effects of social distancing are removed today, the number of infections and deaths are projected to spike between May and June. Hospital and ICU capacity are projected to be overwhelmed if we end social distancing right now. Models indicate that the transmission ratio is straddling the tipping point between increasing and decreasing depending upon how adherent we are to social distancing and what that true transmission ratio is based upon our ability to social distance. What that means is right now is not the time to let up on social distancing restrictions because we're not sure if what we're doing is enough to put the fire out right now. So when can we safely lift social distancing policies? What we can say is that right now, the more adherent everybody in the Coastal Bend and the state of Texas are to social distancing policies that are in place, the faster the COVID-19 outbreak can be extinguished. If we are presently doing enough to extinguish it, it will extinguish it faster if we do more. And if we're not doing enough to extinguish the COVID-19 pandemic right now, we at least need to maintain our current level, if not ratchet it up a couple notches, to make sure that we're doing all that we can to stop this before it really gets out of control. The present levels of social distancing may be enough if kept in place, but there's too much variation in model inputs to project a safe end date, and it's clear that today, from the modeling that we've done, is not the day to end social distancing, or even roll it back one notch. If anything, we need to crank up social distancing one or two more notches to make sure that we're extinguishing that fire of COVID-19. There's new information that's becoming available every day, and we expect the variation in model output to decrease as data becomes available. So what this means is stay tuned. This is not going to be the last report that we have. We're going to continue to take in new data. The models are changing every day and being improved. The data that we're getting is improving every day, and we're going to be able to do a better and better job of projecting what will happen based upon the data that we have in hand with COVID-19 in the local area, and we'll be able to get to a point to predict when would be a safe day to ease back on social distancing restrictions. Excuse me. So, in summary, social distancing saves lives. It's important that we follow the orders at the city, county, and state and federal levels. These are not just, hey, do it if you want to. These are really important. If you value the lives in the Coastal Bend area of your friends and your family, then it's really important to adhere to these social distancing guidelines. We can't allow a wave of potential COVID-19 hospitalizations. Even if you think that it might be a good idea to just let COVID-19 wash over Texas or the Coastal Bend area, and then, as the Lieutenant Governor stated, to sacrifice, and take the chance that maybe you would die from COVID-19, but it would prevent our economy from failing. Realize that if we allow that wave, it's going to overflow our hospitals, and then everybody else that needs hospital care is going to have a difficult time getting it. And that's something that we must avoid at all costs. You can do things to help push the transmission ratio below 1 to extinguish COVID-19. The first, as we've been saying, is to follow local, state, and federal guidelines. Wash your hands often, avoid close contact, stay at least 6 feet apart the latest data says you should stay farther than 6 feet apart from other people. Cover your mouth and nose with a cloth or face cover when around others. This is not just an idea that we're presenting. This is the CDC suggestion for all Americans to do this at this point. We did not model face mask usage in our social distancing guidelines. So if there's one thing that we think that everybody could do right now to push down the transmission ratio of COVID-19 below 1 in the coastal bend, it's for everybody to wear one of these face masks or a scarf or something in public that covers up your nose and mouth, prevents you from spreading COVID-19 if you're asymptomatic, and prevents you from contracting it. Now, it's not 100% effective, but I know of a study of the flu from 2008 where people in households where somebody had the flu, the people who didn't have the flu that wore face masks and washed their hands reduced their chances of contracting the flu by 80%. So these face masks can be very effective. With that, I'll leave you with this GIF that shows how COVID-19 could spread or how that spread could change if we social distance. Thank you very much for your time, and I hope everybody stays safe over this holiday weekend and stand by for new reports. I know that the state, federal, county, and city governments, as well as us here at Texas A&M Corpus Christi, are working hard to try to make sure that we contain this COVID-19 outbreak and prevent a second wave and prevent it from getting out of control.